Welcome. This is great to start this afternoon for our Asia colleagues who are online as well. Welcome to this event, which is the promises of and challenges of digital healthcare. We have two invited guests with us, which is a pleasure. I'll introduce you shortly. So let's get started. We have not just you here in the room, we also have a lot of people online. We had 600 registrations yesterday, so let's see how many are actually coming through here. I would like this to be an interactive session as well, but how we organize ourselves is actually through a Slido, which, if you can go to the next slide here, if you take your mobile phones out and we can actually get started with the first quick question to you. And it's actually a poll, and we'll look at that just shortly. But before we do that, I'll give you a short introduction into why are we here, what are we trying to achieve here, and an introduction to my guest speakers here on the stage. So COVID, I think, changed the world dramatically. COVID changed the whole digitalization path for many organizations, including the healthcare sector, we hope. Right? So we'll discuss that a bit further. Has this transformation really happened? What are the challenges that have been identified? But clearly what we have also observed in the COVID crisis is that the healthcare systems have underperformed. And they came out of the COVID crisis with the significant gaps, right, that needed to be fixed and filled. And particularly also staffing. Staffing is a big one, right? We're all looking for healthcare managers who actually are professionals in the healthcare system who can help actually make that an efficient administration system. Here again, an opportunity for digitalization to come in to fix the problems we have. And I think this is what we would like to explore here today. It's exactly what is happening out there, what are the big drivers here for digitalization in the healthcare system, what is holding us back on fully digitalizing. I'm just thinking of Switzerland, who hasn't done yet the full step of integration and digitalization. But what is holding us back here? Why are we where we are? And what are the healthcare system differences that are driving this agenda? So with that, I would like to actually do a quick introduction to our two speakers. And here on the left side of me is Maulik Majmudar. And Maulik is a cardiologist and the chief medical officer and co-founder of Biofourmis. That's a virtual care delivery and digital therapeutics company. Prior to that, he was actually also medical officer at Amazon and associate director and of the Healthcare Transformation Lab at the Massachusetts General Hospital. So welcome, Maulik, here to stage. And then we have Claudia Witt with us here as well. She's a full professor in medical faculty of the University of Zurich and director of the Institute of Complementary and Integrative Medicine, also at the University of Hospital Zurich. And she's a co-director of the Digital Society Initiative here with us today on stage. So welcome here as well. So to get us started, let's look at the poll. You have had hopefully all the chance to already vote, and let's have a look at what is actually digital healthcare and what does it mean to you? Digital healthcare is such a broad topic, right? And I think it's wonderful to see actually how you reacted here and how it's still reacting, which is very good. So why don't we get started here on that one? And Claudia, when you're looking at the results here, what is your interpretation of digital healthcare? How do you define that?
So I would like even to broaden the field. Being the co-director of the Digital Society Initiative, we're really about shaping the digital future of our society. And we have to understand that digital health is only really one part of it. And to explain a little bit what I mean here, I would like to use 3 examples. So think about workplace, and you want to reduce stress in your employees. You can initiate a digital health program there for stress reduction, but you would like to increase efficiency as your motivation and reduce errors perhaps due to stress. At the same moment, you also increase health because stress is one of the big predictors for chronic diseases. Another thing is we can learn a lot from AI. AI is so broad, artificial intelligence. And thinking about finance, we have algorithms which are used to predict who should get a loan and who not. But these algorithms have bias in the data because they are not trained on really all available data, and they also have an issue of fairness in it. I can tell you it's harder for women to get a loan than for men due to fairness and bias issues. We have the same in medical algorithms, where we also have bias in the data. We have fairness issues if we use algorithms for resource distribution in medicine. And then the other thing is, how do we get these things adopted, implemented? Do we really trust? Trust is a main predictor for the adoption of digital health. So who of you here, I only can see those in the room, is using ChatGPT? Good. Many of us. It's a generative AI algorithm. And due to using ChatGPT, we might change our trust, which also will perhaps change our trust in AI algorithms in medicine. So what I want to say here, these things are highly interconnected, and digital health is one part of it. But I also want to come to digital health, because when I see here these categories we have, I've done app research for over 10 years. So developing apps, putting them in randomized controlled trials as an academic, not as a company. And it was an easy, clearly described field. It has totally changed. So my newest project in Germany, which is an innovation fund-funded project, we have an app, we have an AI algorithm, we do telehealth with video consultations, we will link to electronic patient records, we even have to include data from the health insurances, and we have prevention in. It's complex. And this complexity makes it so difficult. What I mean here is we really are a large consortium, and we need a different skill set, but we also have to address this complexity, because if not, we will just burn money and won't increase women's health. This project is on women's health at the end. So for me, to summarize here, digital health is part of a much broader framework of digitalization of our society, and there we can't think about single areas anymore, because they're all interconnected. Apps include telehealth, apps include AI algorithms, and vice versa. That would be my take home here in the beginning from this poll.
And Claudia, as you were speaking, actually it changed, right? And but it looks like there's a block in the middle, right, that actually all move together.
Yeah.
But yeah, Maulik, what do you think? Is it as defined as telehealth, or how do you define digital health?
Well, first of all, thank you again for the invitation. It's a real pleasure to be here with you guys today, and for those joining online. So if you think about the definition of digital health, I mean, literal definition is really around the digitization of traditional physical brick and mortar analog health to virtual and digital means. But really the only reason, from my perspective, we talk about the word digital healthcare is because as an industry, healthcare has been very slow to adopt and transform or transition from analog to digital world. If you think about other industries, as you mentioned, Claudia, around finance or banking or airlines or retail, we don't talk about online banking, it's just banking. So I think one of the reasons there's still this conundrum about how do you define it, and we still use the term, is just, again, we're not there yet. In terms of the question here, I mean, it's a little unfair, right? If you think about it, all of these things, all 5 things are in the spectrum of digital health. Some of them are tools, as I think about digital health as a tool to achieve some outcome or goal, which either is access to care, quality of care, better diagnostics, better therapeutics, right? Or prevention. So some of these are tools, like telemedicine. It's interesting, and it's not surprising, that telemedicine is the most common answer here, given how much it's exponentially exploded during the COVID pandemic. If you think about the US as an example, when I was running an innovation lab at Mass General back in 2015, we tried to launch a telecardiology clinic. And we had 2 cardiologists that volunteered out of probably 50. And we did maybe 50 visits the entire year. It was like pulling teeth to get people to adopt telemedicine. And then comes COVID, and overnight, people transition, and they did, close to 10,000 visits in their very first year. So it just goes to show you a lot of the challenges with adopting some of these tools is not that technology, to your point, doesn't exist. It's what are all the other ways people will drive adoption, the lack of adoption, right? So some of these are tools, and some of them are actually applications. If you think about prevention here or wearable devices, really is talking about the application of digital health to certain aspects around, again, prevention, diagnosis, monitoring, or therapeutics, right? So in terms of digital health, again, at least in the US and globally now, the definition is very all-encompassing. It's actually a little bit of a challenge now because everything's digital health, right? If you think about it, everything has some software component to it. So we have to get very precise when we start talking about what aspect of digital health are we referring to when we have these conversations, because otherwise everything in some way or shape has software components to it nowadays.
Yeah. And I think you mentioned that, Claudia, before. Trust is a big one, right, in this adoption, right? I guess that also plays a major role. Mm-hmm. And if you're now, and there were lots of hands going up actually once we talked about ChatGPT, and I hope not everybody is using it to diagnose themselves and get their treatment options out. But actually, if you try it, it's actually fascinating, and it gets you something back which is really in a storyline. It gives you exactly this is what you have, and these are the conditions, and these are the treatment options, and these are the drugs that you should be taking. And now you go to doctors, they're like, ChatGPT tells me I should do this, right? So is this building trust or not? How do you see that? And Maulik, maybe you're working in that field quite a bit there. But
yeah, it's a great question. Look, I think of these things as driving information access and reducing the information asymmetry, right? So if you think about ChatGPT, so I took a red-eye flight last night from DC to Zurich, and when I landed, I went to Wi-Fi and used my ChatGPT app, actually. And I asked the question, what are some of the success stories of digital health? And ChatGPT gave me some really great answers. And then I asked the question, it was high level. So I said, give me some very specific examples. And actually gave me company names and studies published in digital health. So within, 60 seconds, I had prepped for this session. No, I'm just kidding. But the point being that if you take somebody who hasn't spent, like you or me, 20 years in the field, studying it, evaluating it, you can quickly catch up into what are the amount of literature out there and the speed of innovation. You can quickly use these kind of tools to get up to speed. But the challenge with these things is the 80-20 rule, right? Mm-hmm. It's very easy to get 80% of the way there with tools like the internet, ChatGPT. But the last 20%, where it truly requires a level of skill and expertise for that confirmatory diagnosis or the clinical action plan, the intervention, that part, we clearly are not there yet with any of the digital tools. So I think, as I think about the roles of these tools, it's great to drive some level of information, reduce information asymmetry, and get some level of skill and knowledge up. We still requires the last mile, which I think is missing, which I think is supposed to be that way, because you still require the domain experts to drive the last. Mm.
So Claudia, what do you think are the main drivers for these adoptions? Is it a regulator? Is it a fee system? Is it a culture around it? Is it access to devices? I mean, it could be all of that, right? Mm-hmm. Or nothing?
I think, as we already mentioned, trust is an important part, but trust is influenced by many things. And cultural aspects strongly influence it. So when we see, for example, the Nordic countries, we can go in the direction of Sweden. Things are so much more transparent there. You can have a look in tax records of other citizens. And I think the trust, having your data in a database and being transparent, is different there than it is here in Switzerland or, for example, in Germany. So cultural aspects are part of it, but access is another aspect. And I think we have to be very careful in our developments, and I like our digitalization very much, but still we will have a part of our population who won't like to participate or who can't participate. And we still have to offer proper healthcare to those who don't want to be part of the digital world. And the other one are the health professionals, and I'm one of them. And at the end, we have to learn how to integrate AI into our interprofessional teams. So we are still in the learning process, how we work great together as an interprofessional team, all human. And now we have artificial intelligence, and that's something different than just having information from the internet. We have to integrate it, we have to learn the communication skills here, we have to learn how we trust and what we need all. And I think that's one of my main messages also, we all need digital skills. I mean, all of our citizens, that we can make informed decisions together, and we have to start now, not in 10 years, that we are prepared for what is coming in the future.
Quite interesting that you're also saying, like, look, the medical doctors have to make the move as well, right? And do you think if we change the healthcare reimbursement system and say, like, digital is a drug, or is be treating as a drug, and actually the doctors are giving it away as like a drug treatment scheme, is that going to change then their mindset? Is that helping?
So there are examples. Germany is already doing it. You have the kind of DIGA there. I call it a digitaceutical. You can prescribe it. I was even involved in the evaluation of one of these DIGAs. I think it's a really nice idea to have something which has a well-evaluated level. It's even a kind of fast-tracked evaluation. But when you look up the DIGA registry at the moment, you have around 50 DIGAs in, and less than 20 are permanently in. The others are still running their trials. So it's still not a big market. And then the physicians or psychologists who can also prescribe have to prescribe it. But then imagine your patient coming and say, okay, can you explain how this is working on my mobile device? And you even can't bill the time you put into this explanation. This shows a little bit that we need this complexity addressed. If we have to address it, we have to be trained in it. We have to be able to bill for it when we spend time on it, and then it will be easier adopted. If not, patients won't get it enough.
Yeah, and with all the devices out there, it doesn't make it easier, right? Mm-hmm. So, yeah, absolutely. There's still people out there with their old Nokia phones, right? They're still running because their batteries are endless, it seems. But anyway, if you're looking at this now from a healthcare system performance in the US, we see a lot of costs, right? And underperformance somehow as well. And particularly now also with mortality outcomes after COVID, we've seen where there are deficiencies. Is digital health helping us to fix that gap? And how quickly is it progressing in the US?
Yeah, great question. I mean, I think I would say, look, there's some, as I was mentioning earlier, there's some really good examples of success stories where digital health truly has, again, seen successes. And I could think of a few examples here, right? So in that spectrum of public health, to sort of wellness prevention, to diagnosis and monitoring. Great examples along the whole spectrum, but just something as simple as think about the use of digital technologies for surveillance monitoring or contact tracing during the pandemic. It's a great example of leveraging technology to drive a true public health good, whether it be epidemic surveillance or contact tracing. I think people use that. And I think there were some real benefits to that, at least in the US and elsewhere. If you think about just one step further around access to care, again, this example that telemedicine adoption significantly increased during the pandemic, and it's another great example where people deployed digital health technologies and tools to drive access to care, not just for people who are sort of like, what we call worried well, but really for patients who actually couldn't get to the hospitals, right? Whether for isolation purposes, transportation issues, their hospitals obviously were understaffed at the time. So these patients literally was a life and death matter where they couldn't get true access to care. And because of telemedicine, people with complex congenital issues or transplant patients, they were able to access care using technologies. So I think those are some examples where there truly are successes. But overall, as an industry, I do believe we're still significantly behind the adoption curve. And I think just to summarize what Claudia was saying here, which is I feel like there are different reasons why digital health hasn't been adopted as quickly as we would like in different geographies. But ultimately it comes down to me to 3 Ps. It's always people, products, and payments, right? At least from my experience. So the people part is all about change management and culture. You talk about culture change from a patient perspective, it's also a culture change from a professional provider perspective. I mean, it takes a lot of inertia for healthcare professionals to change behavior, right? They are usually risk averse. They're usually skeptical of new technologies, and they're obviously worried about their workflows, right? A lot of these technologies add more burden and time and cost initially. So that the people part is really, to me, very critical in how do you drive adoption and change. Mm-hmm. The second part is product. Well, for product, there's two components of product. One is the actual technology itself. There are pockets, even in the US, where connectivity and access to Wi-Fi or housing are issues still. So even if you have technologies, it's not evenly distributed, the access to those technologies. So there are geographies and zip codes in the US there is no telemedicine even, because they can't participate, right? So I think that's still a product problem. The other part of product is proof, validation. You talked about randomized controlled trials. Usually, for most healthcare professionals to adopt new technologies, they would want to see real strong evidence that is validated, which means it's safe and that it's effective. Both, right? Safe and effective. A lot of times, people jump to it works without the safety part. And I'll give you an example what I mean by that in a second here. So that's the product. And the third, which is really critical, at least in the US, I think it's probably most places in the world, is payment. And what I mean by that is sometimes there aren't natural mechanisms to pay for these technologies or to pay people, healthcare professionals, to use the technology. So as we think about the different economic models of financing models of healthcare, whether it be the UK model or whether it be the US model, you have to find a way to pay for these things for the time and the cost of the product. Otherwise, it just won't be adopted, unfortunately. So I think these are sort of the common, probably 3 Ps I feel like really hold us back from a wide-scale adoption. But I think we're getting there, and a lot of those things are being resolved as we speak.
What has no cost has no value, I guess, right? So
there you go. There you go.
Quite important. Right. So I would like you also to be able to participate, and we continue here for another 15 minutes. But in the meantime, you have actually the chance to go into Slido, put in your questions, and for those also online, please use that feature. Go in there, put your questions up, and then we'll take another 20 minutes here to answer actually your questions that you had brought along. But before we do so, let's continue here a couple of more minutes, right, on our discussion. It's getting really interesting. So, Claudia, maybe on your side, you've heard now about the US, right? You've been also working across a number of different countries here, Israel as well. Where are the countries where we can learn the most from? On where did they get the digitalization already, or are getting the digitalization right, and we can benefit and learn from them?
I think there's always a difference between having strategies on a political level and having it really implemented. And when I say implemented, it comes really sometimes to the nitty-gritty details, like having your data in your health records structured in a way that it is not text data and not PDFs, as it often is, but have it structured that you can really transfer the data into other databases, being interoperable between different databases, not only in the medical system, because as we have learned in the pandemic, there's also other data, like travel data, for example, or environmental data, which is important to link with the health data. And there are these kind of digital health indexes. And when we look into those, we see that the Nordic countries like Denmark, like Sweden, are pretty good in it. And if it comes really to having it done in detail, having this data available, using this data also, having it coded in a way that you can transfer it, Israel is also a very good example, also during the pandemic with their green card for vaccination and everything. So I think there are countries where we can learn a lot from. And we have to understand that we have a difficult situation in Switzerland because we have now started this DigiSanté project where we really try to harmonize it. But so far, a lot of our data is really scattered on cantonal level and even different formats. So even coding being female is in some cantons differently coded. And having this semantic clear, which is now something we all know, and being interoperable with FHIR and other standards between the databases, that's something we learn here a little bit later than other countries, but we have to learn it.
Yeah, definitely. I think we need to make some great progress here, and it's good that all the data providers out there have systems in place, right, that work and can actually show the use case. I think that's quite important that we learn from other countries here. But you know, when it really comes to the healthcare delivery, right, as you said it quite nicely, Maulik, is kind of we need to deliver a system that is effective, is cost efficient, right? How do we prove that if we don't even track the data correctly, right, and make it interoperable, right? It's a huge data play that is missing, right, to actually prove that we are cost effective, health effective with these tools.
No, absolutely, absolutely. I mean, I think if we really wanted to, the 3 Ps I mentioned, right, if you wanted to validate, to your point in this case, the economic impact of digital health, you will need sort of this partnership between the healthcare provider system, which for the most part is hospitals and health systems or independent private provider groups, with the health plans and insurance companies to really understand the impact both from a quality perspective and then a cost or utilization perspective to ensure that some of these tools are actually driving the intended outcomes. One of the challenges right now, and one of the sort of internal debates we have as a country is what is the trade-off between convenience and quality, right? A lot of times, digital health tools drive a lot of convenience. It's yet unproven if it always drives higher quality. An example of that is there's a paper published from some professor at Harvard about maybe 5 or 6 years ago now. They looked at the early use of telemedicine, which is episodic transactional interaction between consumers and a healthcare provider, and what was the rate of antibiotic prescription for just chief complaint of a cough. And what they found was that the rate of antibiotic prescription was significantly higher in telemedicine compared to brick and mortar clinics. Now that's a problem because we know vast majority of those cases are viral and not bacterial. And it has at least a probability of raising antibiotic resistance. So not only do we want to measure the cost, but what's harder is how do you measure quality? And what is the definition of quality? It's actually not always that easy. So we'll need some real, alignment in what are the metrics that are measurable, quantifiable, and then actually measured in a structured way when folks have this use of digital health tools or digital technologies to make sure over time that we're driving, again, the intended consequences. I do worry a little bit about the example you gave, jokingly, around self-diagnosis. But a lot of those tools are available today. And patients, because of access to care is so difficult, nobody wants to wait 4 hours to 8 hours in the emergency room or wait 3 weeks for a doctor's appointment. So they're just going Dr. Google, and they're asking the question not what the diagnosis is, but should I go see a doctor even? Or can I just do a telemedicine consult? But as we say in data science, garbage in, garbage out. So if the thing you searched for wasn't the right set of symptoms, the right set of questions, the answer you get may also be incorrect. Yep. So how do you drive, again, a little more education awareness? And I think this is where there's a huge opportunity for a healthcare system to drive the education, to say, what are the best uses of digital technologies to make sure people are using it consistently in an accurate way versus people experimenting with these tools on their own without regulation. We didn't talk about regulation, but that's another key component here. A lot of these tools are unregulated because they're not intended to be diagnostic tools or therapeutic tools. But there's a very fine line between looking up information and is it a screening tool, is it a diagnostic tool, or is it just an information search engine? Like, where is that line? So I think there's a lot of opportunity to think about, again, measurement tools for outcomes and validation, but also ability to influence how people use these tools so it's safely used.
I think that it's quite interesting because what we have seen as a phenomenon is as well that people don't go to the doctor anymore, they go to the emergency care, right? They go directly into the hospitals. which is also a stress to the system as well. Is that something that is actually driven because of the information overflow? Do you see there a connection there, or is it a convenience, right? It's like, oh, going to the doctor now after COVID, I haven't seen him for a while anyway. I could just go to the emergency care and get it done right away.
It's a good question. I mean, I think it's probably different based on geographies, but this in the US, it's multifactorial. But I think the primary reason for overuse, listen to this, overuse of emergency rooms and hospital systems is either lack of appropriate insurance, so they're underinsured or uninsured populations. What we usually say is emergency room is literally primary care for most of those patients, unfortunately, right? So that leads to overcrowding of the EDs and these really long wait times. I mean, you guys probably think like that's insane that it's 4 hours. Actually, average wait time for emergency rooms in the US is like 6 to 8 hours, and sometimes as much as 24 hours. If you look at hospitals like Mass General, which is like the top 3 hospitals in the country even, they're so busy. About a month and a half ago, there were 40 to 50 patients that stayed overnight in the ED because there was no beds in the hospital. So it's that much overcrowding. So the other factor though then is like, well, what's the reason? The other factor is on the other side is staffing shortages. You mentioned that earlier. Yeah. And I think what's interesting is that digital health tools have a huge role to play in both of these things. So one example I'll give you is one of the really recent phenomena in the US is this idea of hospital at home. You may have heard the terminology. It's been around in the rest of the world for decades, Australia, Spain, other countries. But in the US during the COVID pandemic, there was a waiver by the government that hospitals would get paid the same amount for hospitalization as doing hospitalization in the home. Now, the only way to do that safely is to have a set of digital tools to monitor people in the home safely, transmit the data back to the hospital, and do virtual interactions to make sure they're safe in the home environment. Yep. The other spectrum is on staffing, is use digital tools to increase your what's called staffing efficiency. How do you use digital technologies to take the nurse to patient ratio in a hospital setting from 1 to 2 to 1 to 4 to 1 to 8 to like 1 to 20? So again, there's many opportunities to think about digital technologies and driving either operational efficiency and or quality of care to drive better outcomes.
Yeah. So we also talked a bit about, or haven't talked yet so much about the prevention part, right? Which is quite important as well. And I think that's also where a lot of these Apple devices and Fitbits and so on, actually that's where they are starting as well, because that's also where they get a lot of traction. Mm-hmm. It's a good entry point, but is it really holding through? And is that the way of getting that adoption rate through these devices? Claudia, what are your thoughts on that?
I think prevention has a lot of opportunities, and when I see all the think tanks I participated over the last years in, there is a prediction that prevention will play a much bigger role in the future than it is playing at the moment, and that perhaps if we do it well enough, that we need less treatment, and we also want to save costs on a societal perspective here. But that's a part where the wearables, the apps, AI can really play a role, and I think they're a little bit easier adoptable. I assume many of you use also any of those fitness apps or these apps where you can check which content you have in your foods. So we are very much used to it and adopt it, just download the next app. We often not so aware where our data lands and what is done with our data at the end, but the barrier is lower here. And now we are in this area, when is something a medical product with a totally different set of regulations coming up, but also safety and effectiveness play a role, or is just in the fitness area where nearly no regulation is. And I think we will see a lot of change in this in the future, and if we really predict in the future with digital twins and everything, prevention will be important, and I think we will have also to put a lot of effort into trust, because especially with prevention, when you monitor your behavior, and all of us have some unhealthy behavior. And behavior is a risk factor for disease development. So do we really want to be caught if we behave not well, and as a consequence, our health insurance premium is going up? So here it's again about trust, what is done with my data, but we need a lot of data to do proper prevention. But that's a direction which is coming.
Yeah. And yeah, as you said, right, some of our behaviors like BMI is the most costly healthcare risk factor of them all. And then followed only then, I think, two parts down with smoking, right? Yep. So it's really BMI.
Just sitting.
The number one. Oh, sitting. Well, you should probably sit.
And you're all sitting.
That's right, sitting is the new
get
smoking,
moving.
right?
But at this point in time, another 5 minutes, we continue, but then we'll take your questions. So please submit on Slido if you can. Also, those online will take care of these questions here as well. And I guess what would be also interesting to know from you is insurance, right? How can we as insurers help? Do you think we can be part of the story?
Yeah, I think it's interesting the example of wearables, right? I think I agree with Claudia that in the long term, there is no doubt in my mind that these technologies around wellness, prevention, wearables for getting more engagement with your fitness and overall health will be critical to driving kind of health behaviors to reduce healthcare consumption and reduce the cost of healthcare. I mean, every country in the world suffering from this issue of non-communicable diseases are rising at alarming rates. Cost of healthcare is going up. Countries are investing massive amounts of GDP on healthcare costs. So I think in the long term, clearly that's one of the answers. The challenge is short term. Because what happens with a lot of these kind of tools and technologies, it takes years of maintaining good behavior to see a change in the right. And at least in most countries, and at least US specifically, where you don't have a national healthcare system, you have patients are only aligned with a specific health insurance company or health plan for, on commercial, 3 years, 2 to 3 years. And even with Medicare Advantage, it's about 6 to 8 years. But there's no plan that you're with like 15, 20 to 25 years. And again, in US healthcare, when you're 30, 40, 50, you're with a commercial insurance company. When you get to 65, you switch to Medicare. So this idea of health insurance companies, clearly they can play a huge role, but who will take the first step to say, I'm not worried about this patient member being part of my health insurance company. They're gonna go on to somebody else. So do I wanna invest time and resource into behavior change when somebody else will reap the rewards of that investment 10, 20 years down the line? So fundamentally, that's been a massive challenge in the US, is right, that classic shifting of insurance plans every few years. How do you drive investment? So what they've done instead is focus on the costliest, sickest patients where the ROI, the return on investment, is within 12 months. So you take cancer, Alzheimer's, heart disease, right? Those are all where you can immediately see the benefit of the cost of healthcare and utilization within 12, 24 months, but they're not as focused on prevention. So there's this interesting dialogue around who are the right entities that should really drive adoption of healthcare. Is it employers? Is it public health infrastructure? Or is it that all health insurance companies come together and say, well, some of us will benefit. People are shifting around everywhere. As an industry, let's all invest in this. I think you're absolutely right. There's some great new health plan designs globally, but also in the US now, as you were mentioning earlier, that's digital first. Or they have reward systems that if folks take 10,000 steps a day, or they go to the gym X number of times a month or a year, that you can drive your premiums down based on healthy behaviors. So there's great science and behavioral economic science around this about nudges and positive rewards and negative rewards, and how do you drive behavior change. So I think there's a lot we can do. The question is who will really drive that? And I think that's a little bit up in the air.
Incentivization is the issue, right? So
totally.
With that, I think we now move to questions from you. And let's start with the audience in here. If you have questions, please raise your hands. Yes, please.
My name is Rudy Bratman. I heard some wonderful things from Claudia and enabling technology, but I have not heard about languages. What is the problem there where a patient talks to his physician and is not quite sure whether he should tell the truth. So how interpretable are these data or information from the patient to the physician? They speak a different language. And this needs to be translated. And this is the first step to generate also trust. And this is a path to go. And when we have once this more precise data and information, then you go back to research and development in pharma or diagnostics. But as long as this is not properly interpretable, we have a problem. Thank you.
That's a good point. I think with data science, we really have we see the data gaps, and actually we have to reconstruct them as we go, because we know that there must be actually an underlying condition that is not declared or not in the data record, so we have to reconstruct. Yep. How do we deal with that?
We already deal daily with it because we never have the full data of a patient. That's also one of the problems we have as clinicians, because there is no electronic patient record. So when I see my patient, I know he has been with this and that doctor, and I see all the data we have in our hospital. But if he has been in another hospital, I still have to validate some of his or her diagnosis. And in this case, I would say digitalization is really a good advantage if we at one point move to having proper electronic patient records where I, as a patient, have all my data in, understandable data, hopefully, which I also understand as a patient, and then can share this data with the doctors with whom I want to share it and the health professionals. We would have a better level on which we can do a shared decision-making together.
Let's go.
Yeah.
Have you seen how difficult the onboarding is for the electronic patient records? And that's something we haven't addressed here yet. We have to make it easier to participate. And at the moment, it's still due all to the regulation, and regulation makes sense. But it's still very complicated.
So, yes, one more
Quickly,
question. Yeah.
What we lack, at least in this little country, is we are communicating badly. We need to set up a visual for patients that they can see what is going to happen with their data and data content. Thank you.
Yeah. It's a very good point.
Yeah. Absolutely. Any other questions in here? We have one in the back, the very back. And I see we already get some questions online as well. If you want to join, go to Slido and add some more questions.
Hi, we talked about telemedicine and also a bit about reimbursement. And in Switzerland, obviously, it's very complicated to have reimbursement for the care that you do that is not in the MIGEL and that is not really defined. And if we go towards the telemedicine, digital healthcare, how are we able to get reimbursement for the services that we propose that are not clearly defined yet? Yeah, very complicated question. We work on this as well, but I think it's good to talk about this as well, because the reimbursement is very important for practitioners and obviously us.
Well, I'll be curious to, obviously, with the Switzerland healthcare system from Claudia, but I'll give you an analogy though from the US. So, years ago when telemedicine first started, most of the companies that did it didn't have, like you said, a reimbursement pathway. So usually what happens with these kind of technologies is this concept of early adopters. There's always patients and populations that are willing to pay out of pocket, right, cash pay, for convenience. And once you have the initial adoption curve and you prove out the value proposition, it slowly drives policy change. They say, okay, now it'll be covered, right? So I think if you look at the example of Minute Clinic by CVS, Teladoc, American Well, all these companies that started over a decade ago in the US, they all started with direct-to-consumer. And then you realize there's only a small segment of the population is willing to pay out of pocket for these technologies. And the early adopters is a fraction of the population. So then they naturally go from direct to consumer to employers. And at some point, employers will have restrictions and eventually get to insurance. So that's a natural curve that a lot of technologies follow in the US. But I'd be curious here if that's the same model, or how are you guys thinking about reimbursing for some of these access points?
Some of these things are really difficult here, and it was more flexible during the pandemic. So during the pandemic, I could bill a video consultation. But now a video consultation, because its billing is back to the old style, is the same as a telephone call. So why should I set up a more expensive and more time-consuming setup for a video consultation when I get the same money as just picking up my telephone? And the same with apps, so we can't prescribe apps here. Some health insurance companies offer certain apps, but then it's a health insurance company service. And I think that's the same with other regulatory frameworks. We have to be more agile in the future. Because if not, we can't test out innovation, and we can have a kind of test framework, but it is too rigid at the moment as it is.
Maybe I can add one comment to that real quick,
Sure,
which is really, this topic is fascinating to me because in some ways you're asking the wrong question, right? The question you're really asking is adoption of a tool or technology, but really the question you should be asking is, what's the ultimate goal you're trying to achieve? So look at the example that you just gave. I would say the challenge in healthcare for most countries is that value creation is not synonymous with value capture. In this example, you would say the value creation is that the patient had a great experience, they saved time, they saved a visit to a facility, they didn't have to take time off of work in the middle of a day. There's productivity benefit to the company they work for. There's all these benefits, but they don't translate to the same single stakeholder. So part of the reason you can't pay for these things is that the value creation on the patient side, the value capture is not the doctor or the healthcare system, it's actually the company they work for, right? So that triangulation is what the big mess is in healthcare. So you just have to think through like, hey, what are the strategies you could use as an ecosystem of partners that clearly is benefit to that experience? But we haven't figured out how to tie the ROI to either single or multi-entity to then start to pay for these things. And that to me is a conundrum for lots of things in healthcare.
But I hear it again and again, what we established during COVID, flexibility and everything, we just lost it. Right. It's amazing, right? Yeah. Can't we go back a step and say like, there must be things we've learned from the COVID and that we need to keep. So I think on that front, let's move to the questions online here. And here we have the first question here. There's no shortage of digital healthcare apps, but is there enough testing to guarantee they actually help people?
I'm happy to take this one because it's one of my research areas. And it's really interesting when you look into the number of healthcare apps. Last year when I looked it up, it was over 300,000. And I think it's about 1,000, 1,500 or even less, where we have randomized controlled trials to see if they're really effective in doing what they say they do. And this is again coming back to the point where I say we have the whole fitness area, and we have the area where we are more in the field of medical devices. And if it comes to medical disease areas, I would say we have the strongest research on depression and perhaps diabetes, because this started very early. With depression, it started already when it was not even in app format, it was just online internet tools. And there is data showing that when a patient is doing it in a kind of online tool, that it is as effective as seeing a psychotherapist face to face, and it's even more scalable. But for many other diseases, we need this evidence. And research is expensive. And when you see these small startups building these apps, they have to build multiple apps, and they're really not even coming from a background where you develop medical devices. You have to be a totally different type of company to be able to be in medical device regulation. So we still will have this large market, but now we will have a clearly more defined market in treatment areas, and there it's software as medical device.
Yeah. And I guess we also go into FDA approval processes with many of these devices as well. I guess that is a rigorous process in place already.
Yeah, I was going to say, just to add to that, I mean, I think at least in the US, there's this concept, terminology people use, what's called intended use or fit for purpose, which is really important, right? So if you take an example of diabetes, which is a great example, there are apps out there in the marketplace that are for keeping a log or a diary that's related to diabetes. There are apps around education for diabetes, and there's apps for truly management of diabetes. So the intended use of the application becomes the critical decision factor of which of the apps, to Claudia's point, are really designed for that guidance, education, wellness, or lifestyle versus medical diagnosis and medical treatment. And I think that definition by the app manufacturers is really critical to know what is the intended use. And two things. One, you have to communicate that effectively with the audience, because the patients misinterpret, to your point earlier, why am I using this app? And that creates a lot of issues from a safety perspective. And then two, the regulators can't regulate 400,000 apps, for example. So part of the challenge with regulation is sometimes they have to wait for adoption and harm to know how aggressive they're going to regulate, because there is no infrastructure to regulate hundreds of thousands of apps out there yet, right? So it's a little bit of the speed of innovation is outpacing how policy and government can keep up. So part of the challenge you're seeing here is just that. Enforcement is missing a little bit.
Excellent. Let's move to the next question. What are the main adoption successes of digital health tools around the world? And we talked about a number of them. What do you think?
I'm happy to start, and Claudia can add more. I mean, I think we mentioned a few already earlier, but I think maybe if you go down that spectrum from public health and initial diagnosis to think about from a diagnosis and monitoring perspective, again, lots of advances over the last decade have been made around digital diagnoses, or even in-home diagnostic testing is very popular now. And that's all innovation that allows you to do smartphone diagnosis or in-home laboratory testing. If you take a different lens on digital health around pharmaceutical industry, though, again, lots of advancements in terms of using digital tools for trial recruitment. How do we have more participation in clinical trials? How do we get better access to clinical trials for patients in rural areas? On the therapeutic side, again, lots of developments around using data science, machine learning for drug discovery, right? So I think there's many, many examples. The spectrum of healthcare is very, very broad. So I think if you think of these, there are many examples out there, but there are pockets of innovation. I think at scale, we're still, obviously, it's an evolving industry, I'm saying.
And just to bring some hands-on examples, when we think about diagnostics, I think we have great developments in image analysis. Just to think about breast cancer screening and an MRI. So we know there is really research showing that the algorithms are better than the radiologists. And this is just one example here.
Yeah, and I think it's also some of these are in the market. They're quite effective. They're trusted. Skin cancer treatment, scanning, for example, that's quite an effective tool. It works quite well. Its adoption rate must be high there. But yeah, it's really smaller sectors that are coming through slowly. Now, how willing is the medical profession in really embracing digital health care? How big of a block is that? Or are they a blocker at all?
I think it really depends. It perhaps depends also a little bit on the generations and where you work. So if you're working in one of the bigger hospitals, you have to go with the innovation because there's already so much digitalization around. But on the other hand side, we know in Switzerland, I think we have around 15 to 70% of the primary care doctors, mainly the older generation, who don't document their patients electronically. They still have paper pencil recording. But when I see our young generations of our medical students, also other health professionals, many of them are digital natives. So over the time, we will have a lot of change. And on the other hand side, we just have to increase skills, and trust also comes over a better understanding what these tools do and feeling more confident to explain to their patients what they're doing. It has always two sides. I have to understand it myself, but I also have to have the competency to explain this in an understandable way to my patient. And I think we are in a good way here, but still we have some work to do.
Yeah, I would just say that, look, as I said earlier, I think physicians in general, the healthcare industry is usually relatively slow to adopt new technologies. I think it's been proven. There's this common statistic people use that on average, it takes 17 years for any new innovation to achieve wide-scale adoption. Like, that's just a reality, which I think is terrible. But I'll defend my physician colleagues a little bit, because part of the Hippocratic Oath we all took is this concept of first do no harm, right? I think we're having this debate over the weekend with some friends of mine that maybe the Hippocratic Oath should have been, on average, do more good. Because part of the first do no harm is incredible skepticism to avoiding anything that has even the potential for harm, which means just status quo. So I think there is this skepticism. I think the way to overcome that, there's really what physicians know well, which is evidence-based. Just getting information, publications, evidence out there through high-quality research is the way you drive behavior change. If you think about the pharmaceutical industry, right, there's lots of drugs we use as clinicians where we don't know the mechanism of action, or we don't know exactly the side effect profile, but we use it because that's a New England Journal paper that says that this, great monoclonal antibody has this great outcome that's been well studied in a randomized trial and is published, and we just trust it, and it's FDA cleared. How do you do the same level, not the exact same level, but those types of evidence generation to drive both awareness and then adoption by physician community? I think will be the key.
Excellent. We're getting close to the end of this discussion that we have here. It was a lovely discussion. And I have one more question for you guys here. So let's go for that. But first, quickly summarizing, I think we took us quite on a journey here, right? We started with ChatGPT as being the new friendly medical doctor here, waiting for us to be explored. But it's really about convenience, quality versus quality, right? That was a key factor that we discussed here. And I think we also started with COVID. COVID as a big driver in the digital technology coming to market. Adoption rates were high during COVID crisis, but then as we came out, we seem to have lost a lot of it again, right? A lot of the gains are gone again. Can't we go back is the big question mark there. We've talked a bit about, of course, digital health, data. Data is everything. We need to be able to measure. We need to have one system and integrated of approaches to actually diagnostics, to medical care. All the data needs to come together. And then we looked into a couple of good examples where progression has definitely succeeded and integration has happened. Depression, you mentioned, diabetes. These are definitely things that we need to look carefully into and how we can learn from them as well, from other markets as well. We've heard Israel being a good system there as well, Northern Europe as well. And then, good input on our Hippocratic Oath and maybe a statistical approach to it, right? I like it. 50% of doing good is probably a good one. But what do you look into the future? What needs to happen that we get this right? So Claudia, maybe to you first.
I love to look into the future. We just finished our strategy lab for AI in medicine at the University of Zurich. And we see something very clearly coming, which we haven't talked about yet, which is a digital twin. This means our body in a complex software. And this means the whole time putting data into this very personalized software, which addresses data protection. It addresses also aspects, how do I deal with prevention? But I can simulate prevention then, I can simulate diagnosis, I can simulate treatments. So if I have cancer, I can see if treatment A might be more beneficial and have less side effects for me than another treatment. And for this, we really have to prepare. And preparation means more digital competencies for all of us. We have to put them now into the curricula. It means changing regulatory frameworks. Changing them in frameworks which are more agile. And we have to predict in the future. At the moment, we are fixing our current problems in our regulatory frameworks. But we have to see what we need in 10 years, and we need something which is less rigid. And we're not used to it. And I think we really have to change our mindset to address this.
Maulik.
You know, look, as an entrepreneur, I would love to see rapid adoption and scale of digital health, of course. But I think in reality, what will happen in healthcare will be slow and steady will win the race. And part of the reason that slow and steady usually wins the race in healthcare is you just want to make sure that you always remember you're dealing with people's lives and people at the end of the day. And you really want to make sure that you don't leave populations behind, the technology and equity piece, this idea of digital divide. You want to make sure from a safety perspective that it really is measured. Because one of the worst things that can happen, which has happened in healthcare before, is you have an adverse event or a sentinel event because it uses some technology that's not safeguarded. And now the whole field takes like a 10-year step back. Right? That happened with gene therapy 20 years ago at UPenn, right? A single child died, and the whole field just got stuck for literally 2 decades. So part of this thinking around digital health and adoption is, of course, we want to see slow, steady progress, but we just want to make sure that it's done in an ethical way and in a systematic way. Yeah. But as I predicted, there's no doubt in my mind the next 2 decades, this will be, we won't talk about digital healthcare, it'll just be healthcare.
Excellent, wonderful words. Thank you all for joining us in this seminar, much appreciated. Thanks for taking the time to be here. Also our online audience, thanks for submitting your questions and being active part of this discussion. Thank you all for being here. Thanks to my guests here on the panel. Thank you.
Thank you for having us.